Alrighty, wash my hands, all that good dookie, knock. Hello, I'm Nurse Joshy. I'm going to be performing a head-to-toe assessment. Can you tell me your name and date of birth?
Yeah, Joshua Dalton, 83087.
Alrighty, well, I'm going to start with just looking at your scalp. We're going to go top to bottom, checking for alopecia, looking for any kind of abnormalities. We're going to go through there, feel for any lumps, anything that looks weird, take note of any kind of scarring or whatever. How'd you get the scar on your head, sir?
I was in a car accident in 2004.
Oh, okay. Alright, so we're looking, first thing I'm going to do is I'm just going to look at the eyes, make sure that they're perla, people's are equal, round, accommodating, all that. Everything's good. Going to take my light. We're assessing cranial nerve. What we're doing, checking. I will take my ophthalmoscope. Checking the eyes, looking for all the normal bits and pieces. The landmarks. What we'll call it. Then we're taking the otoscope. We're looking in the ears. We're going back and up, looking inside, making sure the cranial, the tympanic membrane's in there. The cone of light's good. Squirt a little air in there, make sure that we see the light kind of reflect off that and all that. So that's good. I'm going to go ahead and assess some cranial nerves since we're already at the head. So I'm going to take this. Tell me what you taste.
Peanut butter.
Okay, take a drink. All right, what do you taste here?
Lemon juice.
All right, that looks good. And since his mouth's already open, we're going to look in there and assess the mouth, look at the tonsils. We're going to grade those as a 1. They're present. They look pretty good. And while I'm looking, I'm just taking note of the skin, making sure it looks normal, making sure that it looks normal for ethnicity is what I should say, because normal is a very, very, very case-by-case word. So anyway, we're doing that. We're looking at the nose, we're looking at discharges or anything, making sure there's no mucus or anything, making sure everything looks equal, making sure that there's no... I like to ask if they're a new patient just to make sure they don't have any deformities or if they've had any accidents in case we have to do some kind of NG tube or anything. It never hurts to be prepared.
So I broke my nose twice, sir.
What is it?
So I broke my nose twice.
Yeah, pretty sure I've had mine broken. I don't know. But we're gonna check some lymph nodes. Looking here behind the ear, feeling there. Gonna take my stethoscope, listen to the tympanic arteries and all that. Temporal, whatever. Tomato.
No.
Listening for anything that sounds bad, anything that don't sound right,
What's
any
the term we're
bruise
looking
or
for?
whatever. Alrighty.
What's the term we're looking for? Brewy.
Brewy. I said brewy. Alright, so press against my fingers. Press. Alright.
Do you want to do? I can
Put your
try
chin all the way
that.
down.
Try it for mine.
Chin back, head back, side to side. Alright, like that. Alright, that's good. Then just do a little rotation. We'll just do a little. Is that good? Yeah, why not? Okay, it looks good. Alright, so we're going to feel arteries here. We're going to feel the thyroid, make sure everything's hunky-dory. Can you press up on my, here we go.
Are you going to fill both my arteries at the same time?
No, of course not. I'm not
Okay.
Xena. We're feeling that. Then we're going to feel that. We're just
There we
feeling
go.
stuff.
Yep.
Sleight of the hand. Anyway, while we're here, we're going to see if you can smell this. We're going to check cranial nerve from 1. You smell that? What is that?
Smells like a prep pad.
Okay, what's this?
It smells like grass.
Grass? Okay, it's grass. Alrighty. We're going to assess his hearing. Can you hear me? 1, 2, 3.
1, 2, 3.
Alright, can you hear me? A, B, C?
ABC.
Alright, we're going to look. Can you see the smelling chart 20 feet away? Can you read the top line?
I can.
Alright, can you cover one eye? Read the smallest line you can. Alright, other eye. Alright, we're going to check the vision. We're going to look at the motor. Alright, eyes are following my finger accordingly.
If I can figure out how to sign out.
Alright.
I might just be able to look at like out of the account or something.
We're going to take this little cotton swab. We're just going to barely touch the eye. Look for a reflex. Alright, that's good. We're going to take this small little chart. We're going to have him read off of that. You read the...
QRST.
Cool, he reads it. He's good. Alrighty, so... I think we're pretty good with facial nerves. So now we're going to move on to musculoskeletal.
In there now.
Oh yeah, your
Tongue
tongue.
in cheek.
So put your tongue over here, tongue over here, stick it out, up and down, up and down.
Yep.
Alright, tongue works. Alright, I think we're ready to move on to musculoskeletal. Alrighty, so
Bailey's chest.
push up on here. Alright, hold your arms out. Side to side. Let's rotate them a little bit. Alright, can we move in? Can we put them behind our back like this? Can we belly. Alright, good, stick your hand out. I'm just gonna feel around here. Got good muscle tone. Feel the joints, feel for any inflammation, anything that sounds out of the ordinary. Can you stretch your fingers out? Close them.
Hey, do we have to
Okay, good.
do this in the same order? So this is, I use it off my phone.
Can you stand up?
There's a twist.
There, yeah.
Rotate your trunk a little bit side
So
to
the way it
side.
does
Alright,
is
can you
it'll
bend down,
play,
touch your
so,
toes, as far as you
I
can.
went with, the
Backwards,
eye
bend back
test,
as far as you
and
can
then
without hurting yourself.
it'll automatically switch
Do a
over
little-
to something that we don't.
what this
So
is, we don't
after
already do
the
it.
mouth, it'll go to, you know, say I'm just feeling.
Yeah, we did elbow flexion,
Alright,
core flexion there.
alright, sit down for a minute.
Okay.
Can you extend your legs?
It'll just switch over.
Alright, can you bend them?
That's fine.
So,
Alright,
head
flex
just,
your
you
feet up.
know, just looking around.
Flex your feet
feel
down.
I'm
Good, can you go out a little bit?
That'll work.
Yeah.
Okay,
Okay,
just
good.
send it in that way.
And
Uh,
then 2 minutes. And then
Lay back.
You'll get a link.
Press on your pelvis a little
I'll
bit.
send you the link and then you can.
Good, on the trunk of the body.
If you're really pressing on the pelvis for stability,
Mm.
you wanna get in there more than that. I'm not
Alright.
saying you have
Get in
to
there.
massacre me or anything right now, but I
Alright.
just mean you wanna get the iliac wings and press good.
Alright, I feel good about that. Let's lie on the table and let's assess your GI.
Alrighty.
Alrighty, first thing I'm gonna do is I'm just gonna inspect it, just look at it, make sure everything looks good, that there's nothing obviously wrong. A little bruise there. Is that a birthmark?
Hmm?
A little bruise or birthmark?
That's a birthmark.
Alrighty, so we're just looking, so first thing we're gonna do before we do anything, is we're just gonna listen to it. We're gonna listen to each quadrant. We're gonna listen until we hear a sound, and we're gonna, if we have to, we'll listen up to 5 minutes. And if we don't hear anything, then we're gonna talk to the doctor, because that means bad. Could mean, there could be an obstruction, could be post-surgery, the anesthesia could be causing stasis of the GI tract. Alright, we're hearing stuff. We're hearing good bowel sounds. You must have just ate. Alright, then we're gonna percuss. Listen to the area, anything that's airy, the intestines or whatever, they should have kind of a hollow sound, a brighter sound. As we move up to the liver, we're going to feel a little bit duller. That's a hard working liver right there.
Mm-hmm.
Alrighty, while we're down here, we're gonna assess for the kidneys.
And then I will email
Which side should be more palpable?
Hmm.
Which side should be more palpable?
I still didn't hear you.
Which side should be more palpable?
Left side?
No, the left side's less palpable, is it not? Is that right, Miss
Yeah.
Napier?
I can't remember.
Yeah.
The right side should be more?
Yeah.
Okay, right side more. Alright, that's good. We're gonna feel around, just feel for any kind of abnormalities, any kind of,
What kind of tenderness, 2 types of tenderness are we assessing for?
well,
Tenderness on palpation and then what?
percussion?
No.
Oh, on the release, yeah.
Rebound.
Rebound
That's what
tenderness.
that's called.
And we would especially want to look for that around the, if they've had a, appendix rupture or anything like that, we would really feel that there on a release. So, that sounds good, that looks good, we're gonna feel for this artery. Oh, I feel that really good, wow. This is really
Probably
bad,
because I'm hypertensive.
Oh.
maybe. Alright, and while we're here, since we're laying down, we're gonna feel the pulses. So I'm just gonna go ahead and do the radial here.
Mhm.
I feel that. Alright, we're gonna do the brachial. Alright, that's good. We're gonna do the femoral. I'm not really gonna get in there too deep. We're gonna do the popliteal. That's good. And dorsal pedis and dorsal
Posterior tibial.
tibial. That's right. And some people don't have one or the other. That's not a big deal. And if we have trouble looking for one, we can always use the Doppler to kind of listen to it.
Mhm.
Alright, I'm pretty satisfied with that. You can go ahead and get up and get in the chair. And then I'm just gonna do some basic vitals.
Alright.
We're going to, we're gonna check your pulses. We did that. We're gonna listen to your blood pressure.
Yeah,
About 120 over 80, that's good. Pulse is good. We're gonna check with an SpO2 monitor. And, he's reading at
99.
Sure, 99. He's reading at 99. And we're gonna take his temperature. 98.6. Perfect. I always say make a wish when it's 98.6. I really do. And what am I missing? You have anything I didn't do?
I'm thinking.
Unlisted, it's almost up there. It says.
Edema, checking for edema.
Yeah.
checking cap refill, just checking skin tuggers, checking for dehydration, checking on the hands, conjunctiva, looking under the eyes, looking at the tear ducts,
Checking the upper eyelid.
upper eyelid. We're checking the test for chest retenting, because if someone's older, sometimes you can't really, when someone's older, sometimes you can't really tell by tinting because their skin will tint no matter what, but when he's relatively young, he looks good.
Good skin tugger.
Good skin tugger.
I don't know why it's.
Of course, I would take like a popsicle stick
But it
or a
is.
toothpick or something and check, sharp side, dull side, make sure that you can feel it without actually, puncturing the
Thank you,
skin.
you're very welcome. And then
Um,
just take that link and email it to her.
Anything to add? I can't think of anything.
I can click on it.
I think I've covered
Hit
it.
a lot of
Two
it.
of them are stupid.
I feel like I'm missing something now.
Me too, I just can't think
Because
of
it's
what
allowed
one
and
is.
not. This app, the YouTube app, so it's
You didn't listen to my lung sounds.
No, I
My
didn't
heart
listen to your lung
sounds.
sounds. All right, that is what I missed. Lung sounds and heart sounds. So we're gonna listen to the aortic, pulmonic, Ebbs point, tricuspid, mitral point, or mitral.
Yes.
They all sound good. I'm sounding things, then we're gonna flip it over. We're gonna listen to lung sounds.
No, we're gonna listen to the diaphragm, not the bell.
No,
Diaphragm, you're right. All right, so breathe deep. Good.
I know, you're crazy,
Breathe
I
deep.
can't listen to myself that much.
Good. Breathe deep. All right. Deep. Good. On the sides, deep. Good. Deep. And then another deep breath. And another deep breath.
Yep.
No need to hyperventilate.
Well,
Deep
you're the one
breath,
listening to 6
deep
different lung
breath,
fields.
deep breath, deep breath. We all know what we're here to do.
And then you listen to bell, did listen to bell sounds.
And we'll listen to these a little bit too, up in here.
You didn't assess me, you didn't have me swallow.
No, I didn't. Swallow for me. I'll feel that. Take a drink of water for me. Okay, that works pretty good.
You didn't listen for breweries over my, or around my.
Oh, yeah, we'll listen to a brew. No brewskis there. No brewies. Alright, that's good. I'm happy with that, if you are.
No, I think so.
Alright, thanks for coming in, Mr. Hilton.